Ketamine doesn't do anything to serotonin. It doesn't do anything to norepinephrine. It doesn't do anything to dopamine. Ketamine turns on brain-derived neurotrophic factor. It increases BDNF. It increases the receptors for BDNF, and therefore there's more stuff and more receptors for the stuff, and so it drives neuroplasticity very strongly.
Awe Genge, this is Mental Mythos, hosted by Asego Toto.
Hello, everyone. Welcome to another episode of Mental Mythos. I'm your host, Asego Toto. And before we dive into today's incredible conversation, I have a small favor to ask. If you enjoy what you hear today, please take a moment to rate and review our podcast on Apple Podcasts, Spotify, or wherever you listen. Your feedback not only helps us improve, but also helps others discover the valuable insights we share every week. And if you find today's episode particularly inspiring or insightful, don't forget to share it with your friends, family, or anyone you think could benefit from it. Thank you for your support. It truly means the world to us. Now, let's get back into our conversation.
What led you to move to focus on brain disorders and actually how the brain?
Well, in fact, I'm both an MD and a PhD, and my PhD work was on brain development. So I was working as a bench researcher looking at the proteins or growth factors that regulate the development and the organization of the brain. The brain is highly organized. So one little part of the brain is responsible for moving the little finger, and a completely different part of the brain is responsible for moving the thumb of the opposite hand. And likewise, all the functions of the brain are sort of parcellated out that way. And that develops through a fairly complicated process. So I was already steeped in brain science. And then I went into radiology and was a resident in radiology. So I was studying brain scans. I have to admit, I found radiology really boring. No offense to my radiology colleagues. And so I left radiology and went into psychiatry. And I've never been bored a day in my life since then, because psychiatry is so dynamic and it's so immersed in what is going on in the brain. Now, my work has taken me into working with functional brain scans, what are called SPECT scans, SPECT. And I've published extensively in that field and done a lot of research in that field. And those scans allowed us to see things like traumatic brain injury in people who were, diagnosed with depression or diagnosed with ADHD or diagnosed with bipolar disorder, but in fact, they had a damaged brain. Now, the problem is there's no treatment for traumatic brain injury. We just sort of say, okay, you have a brain injury, have a nice life. And I got very tired of saying that to people. And so a colleague approached me and said, hey, I'm working on something that could really treat the brain. And what we started to do was to build on science that was established at Harvard University and Uniformed Services University and NASA, top research facilities who are working on this science on animals, mice, rabbits. Well, the problem is that the skull of a mouse is a whole lot thinner than the skull of a human. And there was no way to kind of grow it up so that it would work on people. Well, that's what my colleague and I set out to do. So my colleague was Dr. Maurice, who has since passed away. And he and I worked in the laboratory to grow this so that it worked in humans. And we began treating humans in about 2013. and published our first paper in 2015.
And in your video, I had to revisit it, and you spoke about this thing that I mentioned, chemical imbalance and serotonin. How, I would say, how can I put this question? How, some actually, okay, let me rephrase my question. For someone that isn't aware of serotonin, isn't aware of chemical balance, how can you explain it to him, to them, and how does, in terms of the brain, how does the brain in a way perceive chemical imbalance?
I'm afraid you're going to wish you hadn't asked me that question. And here's why. The science is now very, very clear that serotonin has nothing at all to do with depression. And chemical imbalances are an advertising gimmick. They were made up to sell the antidepressant drugs. The chemical imbalance theory was never proven. It was a hypothesis that explained why these medicines that increase serotonin in the brain acted as an antidepressant. But the fact that serotonin goes up in the brain when you take, say, Prozac is a happy accident. And I'll prove it to you. Prozac has another name, Serafem. And Serafem is prescribed for premenstrual dysphoric disorder, or what most of us think of as PMS. And PMS is due to the fact that when progesterone drops in a woman prior to menstruation, serotonin goes down as well. And that causes the irritability and the difficulty thinking and all of that goes with PMDD. Prozac stops that. You take Prozac for, 3 days before your menstrual period, you'll sail through your menstrual period with none of that stuff. And the reason that happens is that Prozac increases serotonin in the brain within hours. About 3 hours after you take Prozac, your serotonin levels increase in your brain. Now, if that's true, then why does it take 6 weeks for Prozac to work on depression? Why doesn't depression get better 3 hours after you take a Prozac? It's because depression has nothing to do with serotonin. And this has been proven in major research studies after major research studies. The latest was published last summer in Nature. And it's controversial because all of psychiatry depends on the fact that serotonin causes depression, right? It's baked into not only what we are taught as medical students, it's baked into what you as patients out there in the real world are told. The chemical imbalance theory. Here's what's really happened. Prozac and a few other medicines, Effexor and amitriptyline and a few others that have actually been studied, increase the growth factor, brain-derived neurotrophic factor in the brain. And BDNF, brain-derived neurotrophic factor, or BDNF, is the driver of neuroplasticity in the brain. And it's neuroplasticity, another word for that is brain repair. So what's really going on in depression, and this is true for PTSD as well, whether we're talking about civilians or veterans, PTSD and depression both cause degenerative changes in the brain. The hippocampus, the part of our brain and our temporal lobes that regulate learning and memory and emotion, gets smaller in depression and gets smaller in PTSD. The frontal cortex gets thinner in depression and PTSD. And we've known that for 30 plus years from MRI studies. And when you treat with an antidepressant, the hippocampus gets bigger and the frontal cortex gets thicker. So that has been known for many years, but was not understood was neuroplasticity and brain-derived neurotrophic factor the real drivers of all of this? Or was it this chemical imbalance correction? Now, you know what proved that? Ketamine. Ketamine doesn't do anything to serotonin. It doesn't do anything to norepinephrine. It doesn't do anything to dopamine. Ketamine turns on brain-derived neurotrophic factor. It increases BDNF. It increases the receptors for BDNF. And therefore, there's more stuff and more receptors for the stuff. And so it drives neuroplasticity very strongly. And that's why in our clinic at Neuroluminance, we have a 73% response rate to ketamine. Now, the national average is 52%. That's a whole nother story. But 73% of the people get better when they're treated with ketamine. Their depression gets better. And the response rate to Prozac is about 17%. Okay? Huge difference. And it's because ketamine drives neuroplasticity. Make sense?
It actually does, and it's something that actually you're not the first person to say that in terms of the chemical imbalance theory, and it's something what I once saw, but I can't quite figure it out where I saw it in terms of explaining the chemical imbalance. That something that was made just as you said to sell the antidepressants, and and information like this, it's one of the information that people need to actually, I would say, access to. And one of the things that I realized the fact that people at some point are fed false information and they are not getting the exact information that end up helping them. And it's something that I believe that something that in a way you need to look at. Something that I'm quite interested in terms of, as you said, that depression has nothing to do with serotonin. So what actually causes depression if not those chemical imbalances?
Hey everyone, before we dive back into today's conversation on Mental Matters, I want to share something that could change how you think about health and wellness. Introducing Energy's UVB Light Therapy, a game changer for anyone looking to boost their vitamin D levels naturally right from home. With Energy, you don't just get any UV light, you get targeted narrow band UVB technology. This means you are receiving the most beneficial wavelengths that help your skin produce vitamin D, enhancing your mood, boosting your immune system, and supporting your overall health. Here's why you should try Energy. Personalized therapy. Tailored sessions based on your skin type and health needs. Track progress. The app lets you see how your health improves over time. Optimize recommendations. Learn where and how to direct the light for the best results. Simple to use. The app's interface makes starting your therapy session as easy as it can. With 34 trillion vitamin D receptors in your skin, wouldn't you want to make sure they are all utilized effectively? Especially the modern life often keeps us indoors. Click the link in the show notes to start your journey with Energy UVB Light Therapy. Trust me, your body will thank you for it. Now let's get back to our conversation on mental wellness.
No, it's a great question. It really is. So, depression has both a genetic component and it has a experiential or a trauma component. And by that I mean, if people have experienced childhood trauma, the likelihood that they will have depression as adults is five times higher. So trauma can lead to depression. And why is that? Because trauma leads to a change in the things that regulate growth and the sustaining of neurons and the synapses, the connections between neurons and the circuits in the brain. And so that leads to these degenerative changes. The hippocampus getting smaller, the frontal cortex getting thinner, things not working. So, classically, think about it. When a patient has experienced an emotional trauma and they're, in PTSD or in their bereavement or they're in depression, they can't think. They can't make decisions. They can't motivate themselves because the circuits are offline. They're not working. So that's the trauma experience piece. But traumatic brain injury, actual physical trauma to the brain, a concussive event, increases the risk of depression in the next year 7-fold. It's a huge increase. And that study was done years ago in Washington State. The third thing, or fourth thing, I think is underappreciated until COVID happened, is that infections can cause depression. Now, we don't think about that. That sounds very foreign, but in fact, one of the things I work in is in chronic fatigue syndrome and Epstein-Barr virus, which is herpes 4, and herpes 6, which is just called herpes 6. Those are very commonly associated with chronic fatigue syndrome. And I also see it a lot in my patients who have treatment-resistant depression. And one of the things I'll do if they show positivity for these viruses, I'll put them on an antivirus, and lo and behold, their depression goes away and their anxiety goes away. One patient described it this way. She said, it's like somebody stripped saran wrap off my brain and it could work again. Mm. So that's just viruses. There's also, tick-borne illnesses, Lyme disease. Lyme disease is all over the world. It's not just in New York or the Northeast. There's different species of Borrelia in Australia and Africa and Asia and Europe. And similarly, there are different species of Bartonella and Babesia. And these tick-borne infections, which also can be mosquito-borne or lice-borne, have psychiatric consequences. And my colleague, Richard Bransfield, published extensively, Robert Bransfield, excuse me, sorry about that, Bob. Robert Bransfield has published extensively on the psychiatric consequences of these tick-borne illnesses. So, psychiatry just wanders around and they think, okay, we've got this one thing, depression, right? But if you look at depression, you can have increased appetite or decreased appetite. You can have increased sleep or decreased sleep. You can have increased activity or decreased activity. And in fact, there's 20 plus variations on the theme, and you still get labeled depression. And do you really think that someone who has increased activity, decreased sleep, decreased appetite, and they're sad is going to need the same medicine as someone who sleeps all day long, is lethargic, is eating all the time, and feels sad? Does that make any sense? It's logical. They should need two different medicines, right? It's based on symptomatology, yet they have one diagnosis.
It's in a way, it's new information to me. In a way, it goes back to something that I saw. I remember. I'm not quite remember where I saw it, but I think it was Chris Williams' podcast, or it was the title of CEO, but I'm not quite sure. Whereas I can say that doctors don't know everything. When I say doctors, in terms of psychiatric, in terms of counselors, in terms of therapists. Why do we think that, in a way, how do you, no, let me rephrase again my question. How do, like, how can I put this? In terms of, I'm trying to process all the information that I'm hearing from you, and it's something that actually different. It's new information for me, and as someone that is very passionate about mental health, I try by any means to research, and also again about the brain. I listen to Human Lens Lab podcast, and one of them that actually talks about the brain a lot, and I've never heard this kind of information around. I don't know. I never heard. And I don't know if I can put in the perspective, how can people realize that their, their depression comes from disease or a traumatic event?
So that remains one of the problems, and it in part it involves a more thorough diagnostic workup, and it involves an open mind. So I talk about in my book, Brighter Days Ahead, the idea is that there are different causes of depression, and if you come in thinking that ketamine or infrared light therapy is going to be the magic bullet for your depression, and unfortunately you're in that 10%, or in the case of ketamine, about 23% who don't get better, what do you do then? I mean, you're labeled treatment resistant, as if you're somehow a bad person because you didn't get better from the treatment. And the reality is that that's when you need to start asking better questions. And you need to actually look maybe at the brain. This is something psychiatry eschews. In fact, the American Psychiatric Association put out a piece about 8 years ago saying there's no need to do neuroimaging in psychiatry. There is no reason to look at the brain in psychiatry. Now, as a layperson, you're going, what? Yeah. But this is the position of the American Psychiatric Association. There is no reason to look at the brain in psychiatry. The brain has nothing to do with psychiatry. So psychiatry is, as a field, pick your university, pick your, University of Colorado here in Denver is replete with these psychiatrists who, chemical balance, we just need to increase your serotonin. Oh, there's no reason to look at tick-borne illnesses. We're in Colorado. Dogs get Lyme disease in Colorado. But do we have very well-behaved ticks in Colorado? They don't bite humans? You might want to look. So by having an open mind and asking better diagnostic questions and maybe running some labs, you can start to uncover things that help to explain why someone is depressed. And I think you're going to see in the next 10 years a revolution, not necessarily in psychiatry, but a revolution in brain science around two things. Number one, infections. It's now clear that herpes, the cold sore virus, herpes 1, has a role in Alzheimer's disease. And neurology has fought that for 20 years. But now it's absolutely clear. The second is the power of infrared light as a treatment modality. That is becoming more and more clear. Harvard has a grand rounds once a month where they talk about photobiomodulation or infrared light as a therapeutic modality. Clinics around the country and around the world, more around the world than around the country, are treating people. Down in Australia, they have a whole program for treating Parkinson's disease. Our clinic at Neuroluminance, we're treating PTSD, depression, traumatic brain injury, long COVID, ADHD. We have patients who go through our treatment and they don't need a stimulant anymore. We have patients with long COVID who can't walk up a flight of stairs. They're back to hiking the 14ers, which are right outside my window. Hiking in the mountains. We have Parkinson's patients who have been on the same Parkinson's dose for a decade, and you don't see that in Parkinson's. So infrared light as a treatment modality is just beginning to be recognized. But I think it's really going to become the forefront of medicine.
Such an interesting information that I actually receiving, and I didn't think that this conversation would go this way. As much as I knew that I would learn some things, but not in a way of being surprised on something. And going back to disease that cause depression, would you say that what kind of depression? As we know that there are different kinds of depression, mainly depressions. Would you say that when it comes to disease, there are severe depressions, or
Absolutely. So genetically based depression remains a very sticky wicket. And I devote a chapter in my book to talking about our genetic understanding of depression, and it's really abysmally bad. Despite now we've got 23andMe, so we've got millions of people who provide their DNA, and you can go through and you can run these giant, large-scale searches for a gene that's responsible for depression. Nothing's emerged. Nothing's emerged as, okay, here's the number one candidate gene. We're still got the same 7, 8, 9 genes that we've had for 2 decades. That genetic answer has not gotten better. So this is a genetic vulnerability. Family history is important. But there are other factors that play into whether someone struggles with depression. And I think that includes a holistic approach to understand. You had to look at, diet and lifestyle, alcohol use, drug use, and adverse experiences, and what people do in order to not mitigate, what they do in order to manage the stressors of life. People who exercise, people who meditate, are much less likely to have depression. To give an example.
So, in terms of speaking about people who are exercising likely to have depression. So, in terms of there's this, I would say, trend, or in a way, something that people, when you exercise, your brain becomes more healthier. So, in terms of, let's say, I'm having this, I would say, genetic depression, and I keep on exercising. Would you say that it will, in a way, decrease in a way, or it decrease when I see any changes that are positive?
Yeah. So part of what you're doing when you exercise is that you're clearing out stress hormones, and you're clearing out inflammation from the body, and that will help protect you from becoming depressed, from experiencing that degenerative change that is depression.
Fascinating. It's something that I keep on saying, that it's something that I can new info, and in a way I really appreciate it. When I feel like the whole point of the podcast was to be able to share such information, being able to, in a way, I didn't know how disease were, in a way, interlinked with mental health. How even in terms of causing depression, and something, what according to my knowledge, depression is something that I knew in a way of if you experience a traumatic event that causes depression, that's the only way. I think that's the only way that we are taught that okay, when you're sad, you're depressed. And as much as I appreciate the fact that people are starting to get into that mental health field in a way of trying to advocating about mental health more and more and more. But one thing that I hate is the fact that they're overdoing it. For example, someone who is working, they would say they are depressed because they're just feeling just a responsibility or a chore, something that I actually don't like. But sometimes we look in terms of when it comes to mental health in that sense of, okay, I had a traumatic event, so I have depression, I have anxiety, I have bipolar, all these types of things. But we don't actually look at the brain and realize that, no, the reason why you are depressed is this thing in terms of, as you mentioned, delusion. And because on my case, I always thought that depression comes on also in terms of that thing of interlink between physical chronic pain and mental health, how actually interlinks. Actually, funny thing, an hour ago I had a guest where we spoke about spirituality and mental health, but I never in a million years thought that I would hear that depression or general mental health is linked. It can be linked with disease in a way. It's just a new information towards me, but I'm seeing the time full close of that. I just wanna talk about life therapy, something
Yeah.
that you mentioned, and you found yourself blaming yourself in a way of the passing of your daughter. So, can you explain towards us what's like therapy and yeah?
Yeah, so the science about infrared light therapy goes back several decades, and what has been figured out in research labs at Harvard and Mass General and Uniformed Services Hospital and University of Texas and several other places is that certain wavelengths of infrared light activate the mitochondria. Mitochondria are the little organelles in your cells that make energy. Now, neurons are packed with mitochondria because they literally make it electricity. That's how neurons work. So they need lots of energy. And if you can get those wavelengths of infrared light through the scalp and skull, then you can actually deliver it directly to the neurons. And so what we sorted out was how much power was needed to get through scalp and skull safely to treat the brain directly. And the result is that in our depression study, the response rate was 93%. And these people got rid of their depression. They were not depressed. And they have remained not depressed for years since then. And similarly, our patients with brain injury, recovered from their brain injury symptoms, were able to get back to work. We stay in touch with them, and some of them we're 10 years out, and they continue to do well. Long COVID patients, I have a patient, and he's allowed me to sign the release for me to talk about him. He's a dentist down in Florida, and he was sidelined. He couldn't work because he had a tremor. And he couldn't think, and he couldn't remember things. He had horrible brain fog, and he was tired all the time. And he tried all sorts of treatments, hyperbarics, IV infusions of vitamin C, this voodoo thing and that voodoo thing. And he came up here and he got 20 treatments of infrared light. His tremor went away. His brain fog went away. He had lots of energy. He's back at a very busy clinic. And he doesn't need his ADHD medicine anymore. He'd been on ADHD medicine since he was a kid, and it's gone. And I think that's just way cool.
And actually, funny thing is the fact that I was gonna try, but by any means to dive deep on that ADHD. And it's something that I believe that I don't know about America, but here in South Africa, it's something that isn't people are not aware about it that much because of its rareness. And would you say how, in terms of when it comes to red light therapy, how does it work towards a brain? How does it work to someone that has a brain with ADHD?
Oh, great question. So the way that it works for PTSD or depression is that the mitochondria send signals to the chromosomes and turn on that same protein that I was talking about earlier, BDNF. So BDNF levels increase, and that turns on neuroplasticity. And as a result, the brain undergoes repair. And we actually have SPECT scans of patients who have undergone this treatment. And you can see the brain injury before and afterwards, it's a whole lot better. Now, the parts of the brain that are dead, don't come back to life. I'm Dr. Henderson. I'm not Dr. Frankenstein, right? But all the other parts of the brain get better. And we've shown that over and over again. So, and if someone gets curious and they look at our website, neuroluminance.com, they can see those brain scans of people who have actually improved after treatment.
Thank you so much, Doc, for being here. I really appreciate it. And I appreciate the information. It was very helpful. And it had me wanting to, in terms of as much as I had love for brain science, it gives me joy in terms of trying to look at things that you said and trying to go to these research papers in terms of looking at them in terms of I'm someone that keeps on trying by any means to enhance their information by searching for research papers and treating them and reading them and trying to by any means to try and inviting people like you in terms of trying to clarify something that I might find difficult, and not only it will help me, but also help people out there. And I have a question actually, in terms of I'm looking at your book. I was just looking at your book online. Is it only available on Amazon?
Yeah, at this point, yeah.
Actually, we have a bookstore closer here, and I was thinking of trying by any means to buy it, but I'm quite fascinated and the things that you mentioned here. And again, thank you so much for being here. Thank you so much for sharing.
Absolutely. Yeah.
Really appreciate it. And thank you so much for just being, in terms of being willing to share such information, because at some point that people go out there in terms of something that you spoke about, chemical imbalance, and thinking that it's something that is there. Something that serotonin is interlinked with depression, only to find out that it's not. So through this conversation, I believe that the audience have learned a lot from you. And also I definitely learned a lot. As you saw my face, I was quite, in a way, shocked about the information that I received today. So again, thank you so much. And definitely I will
My pleasure.
leave the link of your book on the description and also your website.